Hi, I'm Dr. Elizabeth Kennard, and I am a physician at Ohio Reproductive Medicine. Our offices are near downtown Columbus at 535 Reach Boulevard, and we're on the second floor, and it's a brand new facility. So I've been practicing reproductive endocrinology for a long time, and there are a total of 4 doctors here. All of us have lots of experience with different forms of fertility treatments. One of the things I have a lot of experience with is using medications to make patients ovulate. And one of the ones that's been around for a long time that we've used a lot is called clomiphene citrate, or Clomid. So now, what do I mean when I say ovulation? Probably everybody knows this, but just to make sure we're all on the same page, ovulation refers to the releasing an egg from the ovary. So a woman is born with all the eggs she's ever going to have in her ovaries. And as she goes through life, they are kind of coming out of hibernation, waking up, whatever word you want to use, and starting to grow. And then sometimes at certain points in the cycle, one of them will get larger and larger and get ready to release from the ovary and go out into the fallopian tube. And that's called ovulation. So there are 2 different times or reasons that we would use these medications. In one case, it would be a situation where a person isn't ovulating regularly, and I'll come back to that in just a minute. And the other case would be in a couple that comes to see us, and we just can't figure out why they're having infertility, and they have a diagnosis of unexplained infertility. And sometimes we'll use those medications for those people as well. So if you aren't ovulating, the poor sperm are swimming around in there trying to find something to fertilize, and there's nothing there to fertilize. There's no egg because the eggs are still sitting in the ovaries. So one of the main reasons we'll use ovulation medicines is to help people who aren't ovulating to try to get one or more eggs to release out of the ovaries or to ovulate so that they're available for fertilization and pregnancy. So normally the way that we use these medicines is we wait for a woman to start her period. And if she doesn't start her period on her own, sometimes we can give medicine to make that happen. Once she starts her period, that's the time when normally she starts recruiting eggs and growing eggs, and one of them will get to ovulate in a few weeks in the normal situation. So when the period starts and the hormones in the body are pretty low, we will add this medication, which is just some pills. You take pills as we would prescribe them, 1 or 2 or 3 of these pills every day, usually for 5 days. And at this point, continuing the medication wouldn't really be helpful because under most circumstances, by then, the eggs are already done competing with each other, and one of them is on the launching pad, and it's going to keep growing, it's going to get ready, and it's going to ovulate in about another week. A lot of times what we'll do then is something to figure out when the ovulation is going to happen or when the egg is ready to ovulate. There are a couple of different ways that we could do this. One thing we could do is very simple, and that is to have you do ovulation testing using kits or tests that you can buy at the store. These are called ovulation predictor kits, and they involve testing your urine to look for a hormone that shows up when you're ready to ovulate. Another thing that we might do is we might do an ultrasound, usually a vaginal ultrasound. And that gets us really close to the ovaries, and we can see if it looks like you're preparing an egg, or maybe more than one egg, that's close to being ready to ovulate. And then after we know that you are going to ovulate or when you are ovulating, we would either tell you to have intercourse, or we might perform an insemination, depending on the situation. As for how long a woman would be taking ovulation medicine, there are some pretty well-established guidelines about how this should be done. In the case of a person who does not ovulate at all, and that would be typically somebody who comes to see us and they never know when they get their period, they might have only 2 or 3 bleeding episodes in a whole year. So that woman does not ovulate. That woman could take this medicine for 3 or even up to 6 cycles, as long as she was monitored and we were sure that she was actually ovulating. we would start everybody on the lowest dose, and then if they weren't responding, we would increase it until we got them to ovulate. Now, the other case that we use this medication is for people who have unexplained infertility. So remember, unexplained infertility patients are women who are having regular cycles. They are already ovulating, and all the other tests have been normal as well. And there's quite a bit of research about using this treatment for those women. And it's not recommended that you do that for more than maybe 3 cycles. And normally it is also recommended that you would combine it with the use of intrauterine inseminations, as well as taking the medication, that you would do both together for about 3 months. And then if it doesn't work to achieve a pregnancy, it's probably not helpful to keep doing it for month after month after month. So, when you're taking clomiphene, there are a couple things you need to know about. There are a list of side effects that people can have, but just like with every other medicine and with everything related to pregnancy and fertility and hormones, it's a lot different from one woman to the next. So, your experience could be entirely different than someone else's. But some women experience headaches, and some women experience a variety of kind of hormonal types of side effects. They may be moody or irritable. They may complain of hot flashes. They may have trouble sleeping, get a little grumpy. If you're having trouble sleeping, it makes you more grumpy. There may be breast tenderness, things like that. It's very temporary. You only take the medicine for 5 days, but it's good to know about these side effects ahead of time. The other thing that we all have to be aware of when you use fertility treatments that are causing you to ovulate is that you could actually ovulate more than one egg. And so fertility drugs are world famous for making multiple pregnancies. Now, this particular medicine, most of the time, you're going to get one egg, you're going to get one pregnancy, one baby. But there is about a 10% chance of having more than one baby, and it will almost always be 2. Pregnancies with 3, 4, 5, 6, all those big numbers of pregnancies, those are not normally from taking Clomid. Those are from other medications that we don't use that often anymore. Clomid is also used sometimes for treatment of men. This would normally be prescribed by a urologist or the man's doctor, his family doctor, or PCP. Sometimes it's used to stimulate sperm production in men who have lower sperm counts. Typically, they would take it something like every other day. They would also potentially have side effects that I described, like hot flashes, headaches, even mood swings or irritability can happen to anybody taking this medicine. So I hope that this has helped you and answered some questions. We're always here for you through the journey of trying to get pregnant and available to answer questions anytime. You can reach us through making an appointment. Our phone number is 614-451-2280. You can also request a new patient appointment through our website. If you have any questions, we're here for you. Glad to help.